Well, chances are that you've heard about irritable bowel syndrome, or maybe you're one of the 35 million adults who silently suffer every single day. Well, Dr. Anthony Lembo joins us to talk about his findings and how people can overcome it. Good morning, doctor.
Good morning, Alex. Thank you for having me on.
It's really good to have you on. So, would you mind sharing with us some of the results from the recent survey that was taken?
Sure. So this was a nationwide survey that included over 3,000 people suffering from IBS. And what we found was that IBS is a very common condition that affects people in a significant way. We found that it impacted their daily lives significantly. It affected their ability to work efficiently, and people felt very frustrated because of their symptoms. And importantly, they were not didn't feel that they could discuss their symptoms openly with their physician. So we're encouraging people to speak early, completely, and often with their physicians to get the correct diagnosis and the appropriate treatment.
Yeah, that's extremely important. And so if someone doesn't know if they have it or if one of their loved ones have it, what are some of the symptoms that they might be able to recognize as IBS?
Yeah, so IBS is a chronic condition. It presents with abdominal pain, oftentimes bloating as well, and and those symptoms are associated with the change in bowel habits. So either tending towards constipation, diarrhea, or even sometimes both. But again, a chronic condition that goes on, because we all experience some change in bowel habits, but this is a chronic condition that goes on for months, oftentimes years.
Understood. Now, what is the overall impact that you think that this has on people's social life and their emotional life? It's got to be hard.
Yeah, I mean, it can be quite difficult. And one of the things we found in the survey that people couldn't predict very well when their symptoms would occur. And so people start their morning and not know if they're going to have significant symptoms. And it creates a lot of fear in the person. It affects their ability to socialize. Sometimes people are always looking to find out where there's a bathroom handy. They're avoiding meals. So it really can have a significant impact.
And so, you know, if someone is suffering from this, obviously there is a way to manage it. So what's the path to curing it look like?
Well, we don't have a cure for it, but there are treatments that are available. And so we encourage people to talk to their physician, make sure they have the appropriate diagnosis, and then start the appropriate treatment. And that can be individualized from patient to patient because the symptoms are different from person to person. And one of the things we found in our survey was that people were getting advice from family or friends and oftentimes following that advice. And again, it can be different from person to person. You really need to talk to an expert, talk to your physician who can guide you. And the treatments can include changes in lifestyle, dietary changes that can sometimes be effective. There are also medications that have been shown to be effective as well, and that can help reduce symptoms. Right.
And you mentioned talking to your doctor. Is there a right and a wrong way to sort of bring that up to them, or you know, the things to tell them? I mean, how do we guide our conversations with our physicians?
Well, the first step is to initiate the conversation. What we found in the survey was that people felt more comfortable talking about sexually transmitted diseases than they did talking about their bowels. So we're encouraging people to speak up about their symptoms. You should describe your bowels, and not only just to say you have constipation or diarrhea, but describe the impact that your bowels are having on your day-to-day routine. And your doctor will guide you there once you initiate the conversation.
More people willing to talk about STDs than IBS. That's shocking, doctor. Now, where can we go and learn more information?
So the results of the survey can be found on the website ibsinamerica.gastro.org. And on that website, there are also links to other websites, including the AGA website, where you can find more information about IBS.
Very good. Dr. Lembo, thank you so much for being on with us today.
Well, thank you for having me.
All right. Now, stay where you are. The Morning Blend will be right back.